Well, my friends, this is another successful case of a gentle lady, aged about 39 years. This gentle lady came to me from the province Tripura of India. She was suffering from pituitary tumor, pituitary macroadenoma, a kind of brain tumor. Pituitary macroadenoma. This is the report of July 2024. There is a heterogeneously enhancing lesion involving sella turcica measuring 1.5 into 1.1 into 1.7 centimeter. That is near about half inch. She was suffering from a brain tumor. The pituitary tumor size of the tumor was near about half inch. 2.5 centimeter equal to 1 inch. It was 1.5 centimeter into 1.7 centimeter. So near about size of half inch pituitary tumor. She was suffering with the symptomatology. We diagnosed the case pituitary macroadenoma. That was diagnosed by the laboratory, and complaint was right-sided headache. The many brain tumors are associated with headache, persistent headache, with nausea, blurred vision. The symptoms vary from individual to individual. The basic symptoms are nausea, headache. Headache may be persistent, usually accompanied by seizures in some cases. The headache generally worse after waking the patient from the morning. This is the most characteristic symptom of a brain tumor, the headache, worse after wake up in the morning. The symptoms of brain tumor are nausea, headache. Headache may be persistent or severe and usually accompanied by seizures in some cases. It is generally aggravated in the morning. It is due to why the headache? The headache is due to lack of or less of intracranial pressure. Now other symptoms of dizziness, vertigo, fatigue, cognitive impairment like irritability, apathy, personality changing, etc. With the advancing of the tumor, there may be bradycardia and hypertension. Some patients may also problem double vision or blurry vision or losing sight and losing sound may be found, or hearing problem may be found. Later symptoms or in some cases. The general or main symptoms are nausea and headache. Our patient was suffering from severe right-sided headache. Now, what is the brain tumor? What is the result of this case? I am showing you, I am telling you. Now the brain tumor are the growths or neoplasms arising from the brain tissue or covering of the brain, that is called meninges. It may be benign or malignant. Like all other tumors, the brain tumors are also may be bad or good. Good means curable, easily curable. They are called benign and some are malignant. Benigns are mostly non-cancerous and malignant are generally cancerous. Now the benign brain tumor are meningioma, craniopharyngioma, pituitary adenoma, acoustic neuroma. These four types are of benign type. Craniopharyngioma generally occurs or found in children and other 3 varieties, meningioma, pituitary adenoma, and acoustic neuroma, are found in adulthood. The malignant tumors are, I have already told in many of my videos, that they are glioma, known as glioma. Another name of glioma is astrocytoma, oligodendroglioma, medulloblastoma, and ependymoma. These are the 4 varieties. So benign are 4 varieties and malignant are generally 4 varieties. Medulloblastoma, among the cancer tumors, medulloblastoma appear only in children, and ependymoma and glioma or astrocytoma are found both in children and adults, and oligodendroglioma only found in adults. The size of the tumor may vary, very small to very large. Benign brain tumors grow slowly, aste aste bare, but malignant brain tumors grow very fast and very quick and spreads from the brain to other parts of the body very fastly. সাম্রাজ্যবাদীদের মতন. So the allopathic mode of treatment is only surgery, but the goal of surgery for a brain tumor is to remove all of the tumor cells, but sometimes the tumor cells cannot always be removed. Sometimes a brain tumor is near an important part of the brain. Surgery might be risky. And in such condition, our homeopathic treatment is very helpful to hindrance the growth of the tumor, and to lifespan of the patient may be increased. So this is the case, very, very successful case. It was a challenge to me, and for the first time medicine, the tumor totally gone away. See, this is the report of 2024 July. There is a big tumor about half inch, and the patient came to me from the Tripura, Agartala. The prescription was only T. occidentalis. Considering the symptomatology, I had prescribed T. occidentalis 1 to 12 potencies twice a day, direction twice in a day. 23rd October, the patient came to me. Now this is the January 21. That means after 3 months. After 3 months, the patient come. Today is the 21st January. The tumor totally gone away. This is the free report. No obvious deep-funnel enhancing lesion is noted in the pituitary gland. So the pituitary tumor of the gentle lady disappeared by only one-time medicine. The T. occidentalis, the greatest antipsychotic medicine of animal. The report shows the same patient, see the name, Mrs. Amrita Sinha, and the same name, Amrita Sinha. And the report, no obvious differentially enhancing lesion in the pituitary gland, no other significant abnormality detected the pituitary gland. Is it not a success in homeopathy, my friends? Is it not a successful case in homeopathy? Is homeopathy slow acting? Is homeopathy has no scientificity? Is homeopathy is not a scientific branch of the medical science? Those bastards are always claim that homeopathy is nothing but the placebo effect. It is not at all a science. I want to give some blows over the cheeks of those bastards. Please see, give the answer. How this pituitary adenoma has disappeared totally. The pituitary adenoma, you know, it is known as anatomically hypophysis cerebri. This tumor was over this pituitary region. It has totally disappeared. So may I ask to the patient whether she is satisfied or not? আপনার টিউমার তো সবাই অপারেশন করতে বলেছিল, ভেলোরে যাওয়ার জন্য প্রস্তুতি নিচ্ছিলেন, আমার কথা শুনে এসেছিলেন, রিপোর্ট তো আপনি নিজেও দেখলেন, পড়াশোনা করা বিদুষী ভদ্র মহিলা, আপনি খুশি?
হ্যাঁ স্যার, খুব খুশি।
তো দিস ইজ দ্য প্রাইজ বাই দ্য পেশেন্টস টু আস. থ্যাংক ইউ ভেরি মাচ. So please remember, my friends, through the not only a simple medicine for what and what it grows, you have to contribute it enormously to the understanding of this remedy. The inner doubt cause of the patient first to spend great energy to portray a pleasing and expected image of the modern world, these great medicines. The focus on image and hiding the unpleasant leads later to a secretiveness or even deceptiveness in all patients. This is called Thuja and Hahnemann's the psychosis and the king of psychosis.